ਕੈਨੇਡੀਅਨ ਪ੍ਰਧਾਨ ਮੰਤਰੀ ਜਸਟਿਨ ਟਰੂਡੋ ਵੱਲੋਂ ਕੈਨੇਡੀਅਨਾਂ ਦੀ ਮਦਦ ਲਈ ਅਤੇ ਅਰਥਚਾਰੇ ਨੂੰ ਹੁਲਾਰਾ ਦੇਣ ਦੇ ਲਈ $82 ਮਿਲੀਅਨ ਦੇ ਪੈਕੇਜ ਦਾ ਐਲਾਨ ਕੀਤਾ ਗਿਆ। ਪ੍ਰਧਾਨ ਮੰਤਰੀ ਦਾ ਇਹ ਐਲਾਨ ਕੈਨੇਡੀਅਨਜ਼ ਵਰਕਰ ਅਤੇ ਕਾਰੋਬਾਰਾਂ ਨੂੰ ਰਾਹਤ ਦੇਣ ਵਾਲਾ ਹੈ, ਜਿਸ ਦੇ ਤਹਿਤ $27 ਬਿਲੀਅਨ ਕੈਨੇਡੀਅਨਜ਼ ਨੂੰ ਸਿੱਧਾ ਰਿਲੀਫ ਦੇ ਰੂਪ ਵਿੱਚ ਦਿੱਤਾ ਜਾਵੇਗਾ। $55 ਬਿਲੀਅਨ ਟੈਕਸ ਲਈ ਡੈਡਲਾਈਨ ਟਾਲਣ, ਕੈਨੇਡਾ ਚਾਈਲਡ ਬੈਨੀਫਿਟ ਵਿੱਚ ਵਾਧਾ, ਨਿੱਕੇ ਕਾਰੋਬਾਰਾਂ ਨੂੰ ਵੇਜ ਸਬਸਿਡੀ ਅਤੇ ਕਮਜ਼ੋਰ ਭੂਗੋਲਿਕ ਇਲਾਕਿਆਂ ਦੇ ਲੋਕਾਂ ਨੂੰ ਵਧੇਰੇ ਮਦਦ ਦੇਣ ਲਈ ਦਿੱਤਾ ਜਾਵੇਗਾ।
Last week, we announced a whole range of measures to protect jobs, small businesses and the economy, from waiving the waiting period for employment insurance sickness benefits to kick in, to increasing support for employers and businesses. We introduced special measures under the work sharing program to help employers who fall on hard times during COVID-19. And if your business faces a cash crunch, we will help you bridge to better times. We're working with our financial crown corporations through the Business Credit Availability Program to protect jobs and businesses with $10 billion in credit. In these extraordinary times, our government is taking extraordinary measures. The measures we're announcing today will provide up to $27 billion in direct support to Canadian workers and businesses, plus $55 billion to meet liquidity needs of Canadian businesses and households through tax deferrals to help stabilize the economy. Combined, this $82 billion in support represents more than 3% of Canada's GDP. Let's start with people who don't qualify for employment insurance and don't have access to paid sick leave. Our government will introduce the Emergency Care Benefit, which will provide money every 2 weeks to workers who have to stay home. People will receive this benefit for 14 weeks for an amount comparable to what would be paid through EI. This applies to people who fall ill, people who've been placed in quarantine or have to self-isolate. It also applies to those who have to take care of a family member with COVID-19 but, as I said, fail to qualify for EI. If you lose your job and you do not qualify for EI, we will be introducing a COVID-19 emergency support benefit to help you. This will apply also to people who are self-employed and have to close shop because of the virus. As part of this economic plan, our government will take additional steps to protect jobs. We will provide employers of small businesses with a temporary wage subsidy equal to 10% of salary paid to employees for a period of 3 months. This will encourage employers to keep staff on the payroll during these uncertain times. And I know a lot of people are wondering what COVID-19 means for their personal finances. For those who've filed their taxes and find out that they owe money, they will have until August 2020 to pay. Families with young kids are going to find the coming months especially difficult, with school closures and additional childcare responsibilities. Parents already know how much the Canada Child Benefit helps with the costs of raising kids. To take some of that pressure off, our government will temporarily boost the CCB in the coming months.
ਪ੍ਰਧਾਨ ਮੰਤਰੀ ਜਸਟਿਨ ਟਰੂਡੋ ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਉਹਨਾਂ ਅਮਰੀਕੀ ਰਾਸ਼ਟਰਪਤੀ ਟਰੰਪ ਦੇ ਨਾਲ ਬਾਰਡਰ ਬੰਦ ਕਰਨ ਨੂੰ ਲੈ ਕੇ ਗੱਲਬਾਤ ਕੀਤੀ ਹੈ ਅਤੇ ਕੈਨੇਡਾ ਅਮਰੀਕੀ ਬਾਰਡਰ ਬੰਦ ਕਰਨ ਜਾ ਰਿਹਾ ਹੈ। ਉਹਨਾਂ ਕਿਹਾ ਹੈ ਕਿ ਦੋਵੇਂ ਮੁਲਕ ਵਪਾਰਕ ਅਤੇ ਸਮਾਜਿਕ ਤੌਰ ਤੇ ਆਪਸ ਵਿੱਚ ਬਹੁਤ ਜ਼ਿਆਦਾ ਸਾਂਝ ਰੱਖਦੇ ਨੇ। ਪ੍ਰਧਾਨ ਮੰਤਰੀ ਨੇ ਕਿਹਾ ਕਿ ਬਹੁਤ ਸਾਰੀਆਂ ਫੈਮਲੀਜ਼ ਦੀ ਇਨਕਮ COVID-19 ਦੇ ਕਾਰਨ ਹੁਣ ਰੁਕ ਗਈ ਹੈ ਅਤੇ ਬਹੁਤ ਸਾਰੇ ਲੋਕ EI ਲਈ ਕੁਆਲੀਫਾਈ ਨਹੀਂ ਕਰਦੇ। ਉਹਨਾਂ ਲਈ COVID-19 ਰਿਲੀਫ ਫੰਡ ਵੀ ਲਿਆਂਦਾ ਗਿਆ ਹੈ ਤਾਂ ਜੋ ਲੋਕਾਂ ਨੂੰ ਘਰਾਂ ਵਿੱਚ ਰਹਿਣ ਦੇ ਲਈ ਮਦਦ ਕੀਤੀ ਜਾ ਸਕੇ।
We talked about exactly that this morning, President Trump and I, to ensure that indeed our economies and our people that are so interconnected in so many different ways will be able to ensure the smooth flow of goods and essential materials and medication across the border. That is something that we remain committed to. We will work in close collaboration on an ongoing basis to make sure that that continues. And these measures will last in place as long as we feel that they need to last. We will again closely coordinate on that as well. Time and time again, that we are looking at all options. We're not taking any options off the table. Every day we've been announcing new measures that we've been able to move forward on, and we will continue to look at measures as they become necessary and the tools that exist to make those measures necessary. I will highlight, of course, that the Emergency Measures Act is a significant step, not one that we feel we need today, but not one that we are closing the door to in the future if necessary. I think right now we are focused on making sure that people who are not getting income or revenue because of this COVID-19 challenge have the money to be able to pay for groceries, to pay their rent, to support their families through this difficult time. We recognize that many businesses are closed, many workplaces have significant slowdowns, if not stoppages, and that is going to have an economic impact. But we also know that the fundamentals of the Canadian economy are strong. And in a number of weeks or a number of months or however long it takes, once we get rolling again, the capacity of the federal government to invest in the economy, to support businesses and individuals, will ensure that we bounce back strongly. We have the fiscal room to do this because of prudent decision making over the past 5 years. We will be able to ensure that our economy gets back up to speed very quickly. Many families across this country who are looking at their sources of income dry up because of COVID-19. Many of them qualify for EI, many workers qualify for EI, and we're making sure that with the elimination of the 1-week waiting period, that money will be able to flow significantly and quickly to them. Many families do not qualify for EI. Many workers do not qualify for EI, and therefore we're putting in place exceptional measures that will flow money to them every 2 weeks. Our capacity to do this is something that we have spent a lot of time over the past days ensuring, because we know that that could make the difference not just between one family facing tougher times or not, but it could make a difference on the health of all Canadians. People need to be able to self-isolate, need to be able to stay home, need to be able to care for their families when their ordinary sources of revenue dry up. That is why we're putting forward $27 million in direct supports to Canadians and businesses. That is why we are moving forward on freeing up $55 billion that will stay in the economy because of delayed tax payments.
ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ ਦੇ ਵਿੱਚ ਕੋਰੋਨਾ ਵਾਇਰਸ ਦੇ 45 ਨਵੇਂ ਕੇਸ ਸਾਹਮਣੇ ਆਏ ਨੇ, ਜੋ ਕਿ ਪ੍ਰੋਵਿੰਸ ਦੇ ਵਿੱਚ ਕੁੱਲ ਕੇਸਾਂ ਦੀ ਗਿਣਤੀ ਵੱਧ ਕੇ ਹੁਣ 233 ਹੋ ਗਈ ਹੈ। ਪਿਛਲੇ 2 ਦਿਨਾਂ ਤੋਂ ਕੇਸਾਂ ਦੀ ਗਿਣਤੀ ਬਹੁਤ ਤੇਜ਼ੀ ਨਾਲ ਵਧ ਰਹੀ ਹੈ। ਪ੍ਰੋਵਿੰਸ ਦੇ ਵਿੱਚ 5 ਲੋਕੇਸ਼ਨਸ ਤੇ ਟੈਸਟ ਕੀਤੇ ਜਾ ਰਹੇ ਨੇ ਤੇ ਹੁਣ ਤੱਕ 17,000 ਲੋਕਾਂ ਦਾ ਟੈਸਟ ਕੀਤਾ ਜਾ ਚੁੱਕਾ ਹੈ।
So again, talked about yesterday the importance of coming together as a community right now, and I will implore all of you to be kind, to be calm, and to be safe, and we will get through the next few weeks together.
Thank you very much, Dr. Henry. As Dr. Henry has reported, our total number of cases in British Columbia is 231, with 45 identified since yesterday. That represents 144 cases in the Vancouver Coastal Health Authority, 58 in the Fraser Health Authority, 16 in Island Health, 9 in Interior Health, and 4 in the Northern Health Authority. Most of those patients, most of them, are resting at home in self-isolation, stable, and we hope, of course, getting better with the support of public health. We now have 13 patients in acute care. We had 7 yesterday. And of these 237 cases, I believe it's still the case that 5 have recovered, meaning they've had 2 consecutive negative tests. Our testing continues. There's a lot of interest in the amount of testing that's done. As you know, we provide precise numbers every Friday. The reason for that is that we want our people doing the work and not reporting on the work all the time. And we now have multiple locations, 5 locations around the province that actually do the physical tests, that run the tests. Of course, many, many more that are collecting the tests around the province. We estimate that at least 17,000 people have been tested, and we will have precise numbers on Friday. But that gives you a sense, if you think back at the amount of testing that's been done when we had our presentation, I believe, on February 28th. We had done, I think, the most at that time, and it was about 1,000 British Columbians had been tested at that time, focusing, of course, on travel at the time. Then the following week, which was approximately March 6th, I think, it was 2,000, and last Friday it was 6,225. The number that you're going to receive this Friday indicates the growing intensity of testing. And while our testing has become more strategic, we are doing more and more of it, and more of it is necessary.